A pleasant good afternoon to everyone present here. After a fulfilling lunch, we move on to the next session of the healthcare laws. I, Gunjan Tripathi, a student of MBA Hospital and Healthcare Management from Symbiosis Institute of Health Sciences on behalf of Symbiosis International University, welcome you all on this session of healthcare laws. The fast-growing healthcare industry is one of the legally complex industry. The rapidly changing healthcare environment requires pragmatic solution to the pressures facing the industry. We have with us Dr. Shashikala Gurpur, Dean Faculty, Law, Symbiosis International University, Director of Symbiosis Law School, Pune, to enlighten us on this topic. Dr. Shashikala Gurpur is a distinguished academician and orator with 24 years of experience in teaching in various law colleges of country as well as abroad. Ma'am is a member on Curricular Development Committee, Bar Council of India, and Academic Council of National Judicial Academy, Bhopal. She has several credits like Legal Education Innovation Award conferred by Society of Indian Law Firms and Menon Institute of Legal Advocacy and Training, and the Award for Excellence in Legal Sector by Vijay Foundation, Maharashtra. She has been recently listed in 100 Luminaries of India by LexisNexis. Ma'am, I would request you to grace the dais.
Thank you for that gracious introduction. First of all, I begin thanking Dr. Rajiv Erevdekar, the convener and the driving force behind this great conference, SYMHEALTH 2017, as I welcome all of you to this learning session, which is going to last for next 150 minutes. First of all, I welcome my esteemed gurus and mentors seated among the audience. I will be inviting you one by one to enlighten the audience. Secondly, it's my pleasure to introduce the theme. I request the operators to give me the opportunity of giving the introduction by playing the slide, please. I'm so happy that this forum has brought together friends from across the continents, and like the jewels on the crown, I've got my mentor and the foremost legal guru in India, Dr. N.R. Madhav Menon. Along with him, gracing the dais as the co-chair is one of the most renowned doctors of Pune, Dr. Sanjay Gupte. Could there be any other better combination of law and medicine than this, law and healthcare than this, as to how we have selected this panel for this session or track? I'm setting the tone for the track before the formal setting of the tone by the best legal brain in the country, the greatest jurist, Dr. N.R. Madhav Menon. So this is a humble effort just to familiarize you with the issues that are going to be discussed today and the discussion that is going to come forth, along with knowledge, information, and a bit of skills in terms of how we could apply that knowledge. I know that large percentage of this audience are pursuing their diploma in healthcare laws. Alongside that, there is a number of audience who are coming from the walks of medicine as well as law. On the other hand, we also have our law students and experts who are joining us by teleconference from our Noida campus, Hyderabad campus, as well as from Symbiosis Law School, Pune campus, which is situated at 25 kilometers distance. I welcome all of you who are here personally, proximately, as well as those who are remotely situated but are with us in spirit. Welcome all of you. Now, by way of introduction, I would like to show before you what is globalizing today. We know that globalization is a process of integration of people, processes, and ideas. In simple terms, globalization is the trans-border flow. Globalization has also kicked up the need of, if not homogenization, at least harmonization of human activities. I would like to show before you why such a harmonization is required in case of regulation of healthcare, in case of laying down standards, which is the job that lawyers do, which is the job that ideas of law and justice do, with the snippet that I'm going to show before you, which shows how trans-border flow of patients and the trans-border flow of healthcare expertise happen. Over to you to show the video, please.
With the cost of medical treatment 65 to 90% less than the US and Europe, India has positioned itself as a destination for medical treatment. The Indian medical tourism industry is expected to reach $6 billion by 2018, with the number of people coming to the country for medical treatment set to double over the next 4 years. The current size of the medical tourism industry in India, in value terms, is estimated at a little over $3 billion, with tourist arrivals estimated at 230,000 in 2013. Top specialties for medical travelers are cosmetic surgery, dentistry, cardiovascular, and orthopedics. Medical tourism is an area that the NDA government plans to tap to drive growth in tourism, and promised that it would build 50 tourism circuits, including a medical circuit, which will connect hubs of modern and Ayurvedic medicine. The medical tourism segment is projected to grow at a compounded annual growth rate of 20% between 2014 and 2018. India is ranked 5th among top medical tourism destinations, beat by Singapore at 4th, the US at 3rd, Mexico at 2nd, and Thailand coming in 1st.
In the Indian context, which talks about inadequate regulations. Inadequate regulations, especially not touching upon the major healthcare provider, which is the private sector. 90% of the healthcare is from the private sector, and 80% of the spending is from personal funds. So we have a situation called healthcare poverty. We also have the situation where existing laws do not even insist upon maintaining minimum standards. Let's go to the next set of clippings quickly. So these are some of the clippings which will highlight the issue which I've told you, that although there are some legislations, those legislations need to be looking at the globalizing landscape of healthcare in India as one of the preferred destinations for medical tourism. Let's go next. It will also show you that the issues of mental health was not at all treated in the way it ought to have been treated, where there are 150 million Indians are mentally ill, 80 to 90% receive no treatment, and it should have been, ought to have been 13% of the health burden, but it's only less than 1% in terms of spending. On the other hand, we also have a pending case before the Mumbai High Court, which was brought up by a Punekar, and in this case, it is a public interest litigation by Atul Bhosle, who himself had been a victim of medical negligence because one of his parents suffered that. He stated about how clinics have been unregistered. Although we have the Clinical Establishments Act, the implementation doesn't seem to be so perfect. So what is at stake today? Today, what is at stake is healthcare, justice, right to life, because already Article 21 of the Constitution has highlighted it. So in order to set a tone for law reform, we have many activists in India who come from the advocacy field, who come from the mainstream law field. So last 1 week has seen strikes by doctors across India because in Calcutta there has been a epoch-making new legislation, and that is the Clinical Establishments Act, which is unlike its cousins at the national level of 2010 or in Maharashtra in 2014 or down south in terms of private establishment bill, is looking at not only regulation and registration but also at transparency. Who drafted this bill? Who helped the government to arrive at such a legislation? It was the National University of Juridical Sciences in Calcutta. We have now a news coming from Karnataka that they have entrusted the National Law School Bangalore to draft the new comprehensive legislation which should be patient-centric. Putting patients in focus, justice in focus, law in focus has come from the field of law. So now I have the pleasure to hand over the session to the chair of the session, who is the founder of both these national law schools, founder, vice chancellor, and the greatest jurist that India has seen coming from the field of legal education, has been in the forefront of many law and policy reforms, particularly in the area of justice education and justice system. I invite Dr. N.R. Madhav Menon onto the dais to chair the session, please. I'm sure sir's biodata will run there. Has it been run already? Yeah. Now, we don't have much time to go through the details, but to put it in brief, you name a field that a lawyer should be in, and Dr. Menon has been there. Sir was the founding director of the National Judicial Academy as well. He has educated the lawyers, he has educated the youth, he has educated the judges, he has been in the policy reform bodies, and currently he is the Chancellor of National University of Educational Planning and Administration under the Ministry of Human Resource Development. Along with Dr. N.R. Madhav Menon, we have Dr. Sanjay Gupte to co-chair the session, who has been the immediate past president of FOGZ, which is a body of gynecologists, and has been the known expert in medical laws in the city of Pune. Dr. Sanjay Gupte, I have the pleasure of inviting you over to the dais to co-chair the session. The three key themes after the clippings that I discussed with you will be dealing with mental health law, will be dealing with comparative and global healthcare law, and the patient safety law. To this effect, we have various resource persons whom we have very carefully handpicked with the wisdom of Dr. Rajiv guiding us. We have Dr. Mohan Agashe, who is a rare talent of arts, film, and medical sciences fused into one. Over to Dr. Mohan Agashe to come and occupy the dais, sir, who is the former director of Maharashtra Institute of Mental Health and Pune Institute of Film. In the first theme, after Dr. Mohan Agashe's explanation of the issues related to mental health through his great productions, which have won international accolades for him, we have Professor Chris Gledhill, Director of Clinical Legal Education, Auckland University of Technology Law School, Auckland, New Zealand. Professor Chris, please come and occupy the dais. Welcome. As Professor Chris is making on to the dais, on my left, please. We have the next session, which will be taken over by Dr. Santosh Kakade as one of the speakers who will be speaking on comparative healthcare law. I request Dr. Santosh Kakade, CEO, Core India Institute of Legal Medicine, Pune, which is a company which has combined both law and medicine in the discipline of legal medicine. Sir, please come and occupy your position on the dais. I request the next person speaking on the theme of global legal dimensions of healthcare, Solicitor Sunita Singh Dalal, who is a partner in AC&H Legal Consultants, Dubai. Solicitor Sunita, please. And now I have the pleasure of inviting somebody who also wears many hats, aside from his positions in the University of Cornell and Harvard on the boards. Dr. Balasubramaniam is a dedicated community healthcare advocate and a great force behind law reform with the Swami Vivekananda Youth Movement from Mysore. Dr. Balasubramaniam has been a great policy advocate, directly conversing with the Prime Minister of India to make healthcare to reach the masses, particularly the deprived segments of indigenous people in Mysore. Thank you, Dr. Balasubramanian. Now, I'll be requesting Professor John Tingle, who will be focusing on the next theme, which is the theme of patient safety. Professor John Tingle is reader in health law from the Nottingham Trent University, United Kingdom. Aside from being a barrister of experience, Professor Tingle has published 5 books in the area of health law and is a world-renowned author in the area of health law and patient safety. I have the pleasure of inviting the most distinguished expert on patient safety, coming from the field of medicine, and also is an advocate for legal reforms by presenting public interest litigation and advocating policy reform in the area of medical termination of pregnancy act. Over to Dr. Nikhil Datar. Welcome, sir. Dr. Nikhil Datar is medical director and senior consultant in Cloud9 Hospital, Mumbai. Now, as we see the galaxy of experts on the dais, don't get into the panic that we may take longer than necessary. We have very strict time restrictions. We had many members coming on the dais because we believe that healthcare justice has many stakeholders. And we have brought almost all the stakeholders in the form of experts over here. Now, aside from that, we also believe that it's not only important to listen to people, to gather information, it's also important to learn how do we apply this knowledge. So we have a number of other people who are going to assist us, and one of them is a team of students from Symbiosis Law School, Pune, who will be enacting with the experts, Legal Medicine Clinic, and the other is our alumna and the partner in Walnut Solutions, who is going to be the quiz master this evening, Mr. Sachin Ravi. So as I welcome all of you, I'm also happy that the distinguished audience like you are going to be enlightened, as well as you are going to support us in the form of participatory learning by participating in our sessions. I hope all of us will have a great learning time as I hand over the session to our chairperson, Dr. N.R. Madhav Menon.
Fellow panelists, distinguished delegates, Shashikala has already given us some insights about the state of the law relating to health and healthcare services, particularly in India. The importance of the subject is obvious from what she has expounded in the few minutes. If you ask me, the legal regime that governs health and healthcare services in India, I would say that you can't locate it in one place. It's very fractured, very inadequate. It is evolving, and neither the legal community nor the medical community have any clear idea as to where the law stands in respect of health services, healthcare and health services. There are a few reasons behind it. Traditionally, we felt that the profession of health professionals need not be regulated. It's a noble and learned profession. It's a divine relationship between the doctor and the patient. And the doctor's ethics, the medical ethics, is enough to regulate the relationship between the health professionals and the patients. But the situation changed over the years, and as it was mentioned, when health became an industry and when globalization complicated the situation and it became a business, law had to step in. Added to that is the technological developments in health services delivery, which has complicated to such an extent that legal interventions have become a must. It is happening incrementally, with the result today we do not have any clear idea about the state of the law and the rights of the patients and the duties of the duty holders, the nature and scope of it is evolving, partly evolved by the legislature and mostly by judiciary in India. In the past, the legal intervention in the health sector has been on the preventive health services, on issues relating to sanitation, immunization, work conditions, conditions of work in industry, environmental hazards and things like that. Of late, the laws are made to regulate medical research, diagnostics, drug production, patients' rights, standards in the delivery of services, and a whole lot of other things on which at the state level there are more legislations than at the central level. We are a federation, and therefore on the subject of health, both the states or the provinces as well as the federal government have power to legislate. We are discussing in this course of this 2.5 hours the issue relating to right to health. If you ask lawyers who are concerned with rights and duties which constitute law, you would get the answer that there is no right to health in India. Because if you scan the Indian Constitution, you find that in the fundamental rights guaranteed to every citizen, there is no mention of right to health, though there is a mention of right to life. But the right to be healthy or right to access to health services has been relegated in the Constitution of India into the form of directive principles of state policy, which are inchoate rights, which are not rights where we are not clear as to who are the duty holders and what is the scope of the right, what remedies one can obtain and from where. So much so, the lawyers would argue there is no fundamental right to health, though our Supreme Court in a series of cases decided that in emergency situations, whether you are a private clinic or a government clinic, you have an obligation to provide emergency medical services. That is recognized as part of right to health, which is right to life, which is in Article 21, as it was mentioned. Otherwise, the right to health has to be found in some legislation or the other, which the state recognizes. And if you look into, scan through that, you find large number of legislations, not necessarily on right to health, but there are provisions in it which refer to certain aspects of health, which is far too inadequate, that too in a country which is full of inequality, illiteracy, poverty. You find that that sort of a situation really denies access to health in the country today. Otherwise, the third source of the right is through contracts. Contract between the patient and the doctor, between the patient and the hospital, part of common law, as you may call it. So there is no fundamental right to health under the Constitution. There are right to certain health rights, instead of calling it right to health, certain health rights or health-related rights in certain statutes enacted by Parliament or the state assemblies, and the rest of the rights are contractual rights which patients may have when they enter into a relationship with doctors and hospitals. I would therefore argue that when you examine this situation in the session on health law, you need to look at the lawyer's perspective and the medical perspective and the common man's perspective. This sort of interdisciplinary dialogue on issues of this nature, which are innate for every human being, will be contributing to the development of the jurisprudence on that subject. I would therefore briefly mention two other aspects, one relating to medical ethics. As I have said, traditionally we thought this is not a field in which legal intervention is necessary. The ethics of the profession will suffice to maintain the standards of healthcare delivery. But what has happened to that? What has happened to the oath that doctors take and how it is being enforced by the profession which has been made autonomous to decide the standards and deal with the violations, etc. How it is in the matter of pharmacists, nurses, and things like that. Many cases, I am sure, in the course of discussion, you will be able to figure out. A recent development in India, in today's paper, I read while in the flight that doctors in AIIMS in Delhi are being provided measures for self-defense. The violence against doctors and hospitals is too frequent these days that legislature had to intervene to protect security at workplaces for medical professionals. That reflects a very pathetic condition of doctor-patient relationship, at least in certain urban centers in India. There was a survey done by the Indian Medical Association for greater security in hospitals and nursing homes. There was a time in this country when doctors were revered as a friend, philosopher, and guide. Today, according to an opinion poll of 1,000 patients by the Indian Medical Association, 90% of the respondents felt the doctors did not listen to them during consultation. And 85% said they were not informed about treatment or procedures or the risks involved. Doctors and their professional bodies need to introspect on causes of widening distress. If doctors themselves do not do it, naturally Parliament will have to intervene. And that will be very unpleasant and unsavory for the profession, and they need to have learning the techniques of self-defense against their own patients. We had a national health policy on which I am sure you will hear from the minister, who promises a right to health by 2030, universal health care. It's part of the Millennium Development Goal. Whether it will come in the form of a fundamental right, as it happened to right to education in the recent past, is something to be seen. But at least as a statutory right, providing certain duties on the part of the state, the local government, on the part of the profession, on the part of the entrepreneurs, private hospitals, etc., will come, and it is slowly developing through the ICMR and other institutions with which doctors are associated. Together with the National Healthcare Standards Organization that is proposed in the National Health Policy and the National Health Information Network, we hope very soon in India, with the growth of health as an industry, we will have standards that are comparable to the best in the world. On the preventive side, we understand the National Health Policy proposes a variety of disease control measures and better management of water, sanitation, nutrition policies to help modern technologies and encouragement of medical pluralism, Ayurveda, and things like that. The emphasis seems to be on the national policy, wellness or staying healthy rather than care of the sick. The policy also advocates local manufacturing of healthcare products so that they are accessible and affordable to ordinary people. This is an issue on which a lot of debate is recently happening. Electronic health records for health services in management are recommended along with telecommunication at the level of district hospitals in the national policy. On mental health, which is another subject being discussed, a separate policy statement together with a legislation, and that's a very welcome thing. I just read through the Mental Health Act of 2017, which appears to be of world-class standards. But let us remember there are not enough mental health doctors, psychiatrists, to be able to service the needs of the number which Shashigala mentioned, people afflicted with mental illnesses. Taking note of the social determinants of mental health, such as poverty, environment, and education, the National Mental Health Policy has come up with certain significant steps towards strategic and preventive interventions to address the medical and non-medical aspects of mental health. Supreme Court is involved in a big way, and conditions in mental health institutions have been considerably improved because of the court intervention rather than intervention by Parliament. Meanwhile, the profession has to work out an ethical code to ensure patient safety and standards of healthcare delivery. It has to have effective in-house mechanisms to enforce the norms without having to let the state promulgate draconian laws that undermine the autonomy of the profession and the nobility in relationship between doctors and patients. Health industry must realize that equity and equality are guaranteed fundamental rights, and a market mechanism cannot operate to the detriment of accessibility, availability, and affordability in health services delivery. Thank you.
Thank you, sir. After that prelude from the legal expert highlighting the issues of justice and law, I would now request the renowned gynecologist and past president of FOGC, Dr. Sanjay Gupte, the co-chairperson, to give his remarks.
Friends, I'm not going to stand between you and the speakers for a very long time, but I thought I would put forward some of my views. A wonderful expose given by the eminent jurist, and why the time has now come that the medical profession is being governed with various laws. Yes, probably there was a time when we had an opportunity to govern ourselves as doctors, which we lost. But as a practicing a doctor, I feel that the things have gone to the extent that the pendulum is swinging entirely other way around. The individual practicing doctor is getting squeezed from all sides. The various laws are coming in. Some, if I may say, absolutely draconian laws as far as the day-to-day practice is concerned. I think we are also forgetting the ground realities that are there in our country when we are bringing forward the laws which are pertaining to a lot of Western countries. I'll just give you a simple example that I happen to co-chair the ethics committee of FIGO, that is the International Federation of Obstetrics and Gynecology. And when I brought forward a point that yes, we must do something, because in our country and country like ours, not just our country, that the doctors are getting arrested for some clinical errors, and we must guide the judiciary also that yes, what our Supreme Court has said, when and where the arrest is only possible. All the other members, mainly from the Western countries, says, what, arrest? We have never heard of it. It hardly ever happens or never happens in our country for clinical this thing, because they have their own organizations who act on it. So when Dr. Santosh talks of comparative law, this is something that will be important. That what are the kind of laws we are bringing in? When we talk of the medicines and writing prescription, writing 3 copies of prescription. When the volume that is there in our country, we want care which is absolutely at a minimal cost. We want the patients to get extra, a lot of time from every single doctor. And then what are we aiming at is just an individual doctor, I feel. We are not aiming at corporates. We are not aiming at the institutions which created the original malpractice by huge capitation fees. They are not looked at. We are not looking at the companies. If the generic medicines are supposed to be there, then the simple task would be just stop making the generic medicines. Everybody will have to, the branded medicines, everybody will have to write generic medicines. That's the question. Keep the quality at the highest, and there is no problem at all. Why should only the doctor be held responsible? What about the various pathies? So we are so confused about who should do what. Even the judiciary is confused, about who should do what and when. So these are the issues also. I hope that, our colleagues will discuss. And finally and foremost is, of course, the patient safety. So if you look at the safety, I'm sure Nikhil will describe, when does the safety come? Who writes the prescription correctly is the, one of the safety aspects. Whether we allow everybody to write prescriptions, where do we allow the chemist even to, sometimes practically prescribe, hand over the prescriptions. So the laws are to be there, should be there, but I think looking at the ground reality, I think only individual doctors should not be really targeted and squeezed from all sides. Otherwise, what's happening now, and that we are seeing in the society, most of the doctors' children don't want to become doctor. That's the ground reality. Many of you will know that, because it used to be the time the cream of the students used to opt for medical colleges. It's unfortunately not happening. So I think all these ground realities also we have to look at when we make different laws and try and control the medical community. Of course, the basic responsibility still remains on the doctor and doctors' organizations. But then the way the elections are there in the doctors' organizations, that itself leads to a lot of issues where the doctors who want to do something cannot really get into it and try and improve certain things. So there are so many issues. So please don't target. That's my request for everyone who is in power, to individual doctors. Look at the whole scenario and let's together make the patient really safe. Thank you.
Thank you, Dr. Sanjay Gupte. Now we move on to the first theme after the deliberations of the experts. The first theme is issues in mental health law. We thought that there is no better prelude to mental health law than to depict it through the life and the work of a person who is very special in this galaxy of experts. He is none other than Dr. Mohan Agashe. So before we ask Sir to respond, I would request the technical team to play the snippet from his award-winning movie, Astu, which for the first time brought to center stage in an expert way, through the medium of film, the plight of people suffering from mental health issues. Once the clipping is done, I request Dr. Agashe to begin his deliberations. Thank you, sir.
पहिल्यांदा तुम्ही तुमचं नाव विसरणार आहात, तुमची नाती विसरणार आहात, तुम्ही तुमच्या सगळ्या आठवणी विसरणार आहात. नाती, व्यवहार, भूतकाळ, वर्तमान.
माहिती हवं. यदा वै विजानाति अथ सत्यम वदति, ना विजानन सत्यम वदति. मी खोटं बोलतोय?
तसं नाही, पण
हे बघ, हे सगळं कॉस्मिक कॉन्स्टिलेशन आहे.
कोणाकोणाच्या नशिबाच्या कुंडलीत काय काय लिहून ठेवते ते सटवाई.
चांगला केक देतो.
त्यांना राहू दे ना त्यांच्याच घरी. बाबा देईल ना 24 तासाची नर्स.
हिमालयात पांडव शेवटी हिमालयात गेले.
आई वडिलांची सेवा मुलं फक्त स्मशानापर्यंतच करू शकतात, आणि हे त्यांनी लक्षात ठेवलं पाहिजे. हाच खरा पुत्रधर्म.
त्यांचं ते अस्तु अस्तु अचानक माझ्या कानात येतं. सो बीट मराठीत नुसतंच असो.
असतो असतो.
ಅಳಬ್ಯಾಡೋ ನನ್ನ ಕಂದ ಹಾಲ ಮಾರಿ ಬರ್ತೇನೋ, ಹಾಲ ಮಾರಿ ಬರ್ತೇನೋ, ಕಾಲ ಗಡಗ ತರ್ತೇನೋ. ಅಳಬ್ಯಾಡೋ ನನ್ನ ಕಂದ ಮೊಸರು ಮಾರಿ ಬರ್ತೇನೋ, ಮೊಸರು ಮಾರಿ ಬರ್ತೇನೋ, ಹಸರು ಅಂಗಿ ತರ್ತೇನೋ.
पण असं मन असू शकेल?
निरभ्र आकाशासारखं निरव शांतता पेरणार. विचार थांबला की सगळं निरवच की.
ಬೆಣ್ಣೆ ಮಾರಿ ಬರ್ತೇನೋ, ಬೆಳ್ಳಿ ಉಡದಾರ ತರ್ತೇನೋ. ಅಳಬ್ಯಾಡೋ ನನ್ನ ಕಂದ, ಅಳಬ್ಯಾಡೋ ನನ್ನ ಕಂದ, ತುಪ್ಪ ಮಾರಿ ಬರ್ತೇನೋ. ಅಳಬ್ಯಾಡೋ ನನ್ನ ಕಂದ, ಅಳಬ್ಯಾಡೋ ನನ್ನ ಕಂದ, ಅಳಬ್ಯಾಡೋ ನನ್ನ ಕಂದ.
the lady who is going to show me time up seems to be missing now. Oh, you're there, okay. Right. Thank you. Well, it's a very difficult issue basically. Law, healthcare, health practice for me. Actually, when I was sitting there and looked at this whole thing,